Welcome back to Health Talk with Dr. Kenneth Levine. You know, you can see us on the web at www.tvchannel19.com, and it can be seen around the world at live streaming. You know, one of the joys I have in my life is watching people mature and grow in their profession. Tonight I have one of my favorite people in the entire world with me. I know this doctor since he was 3 years old. Dr. Dean Fishman is a dear friend. He's my son's best friend for almost 40 years. And we were kids together, and now he is a doctor. He is helping patients every day in his practice. Dean, welcome to our Health Talk.
Thanks for having me.
Let's talk a little bit about what you do and what makes you unique other than being my lifelong buddy.
Well, that certainly is unique. But I'm a chiropractor. My background is in exercise physiology and physical therapy. So I take a whole body approach to the patient. Some chiropractors just work on the spine. We work on the entire body. We take a look at daily habits and routines. We look at their workout or lack of workouts. We look at their repetitive stresses in their lifestyle, and we try to alter that so that we can get better function out of their body. We include exercise routines, we include stretching routines, and we basically teach as well as heal. Most people usually come to us when they are in pain. Not all, but most. But people stay on with us for wellness care. See, the core philosophy of chiropractic care is that the brain and the spine control every function of the body. So an electrical impulse starts up in the brain and travels rapidly down the spine. Out the spine comes these spinal nerves that bring messages to the body and deliver that message so the body functions. If there's an interference along the way, we're going to get a disruption in the message and therefore a disruption in our function. So once our patients understand that message, once they're out of pain, they want to continue on to get better function and then maintain that better function. So we see people all the time for wellness care.
In wellness care, you're talking about some type of maintenance therapy like we do in our dental practice. Tell me what that involves.
Well, dentistry has done a fantastic job in educating their patients on wellness. I use dentistry as an example all the time because it's easy to understand. Here's how I do it. If I don't brush my teeth tonight, I'm not going to wake up tomorrow with a cavity and pain. But if I don't brush my teeth repetitiously and I have poor oral hygiene and I don't floss and I don't rinse, eventually over time I'm going to have degeneration and then a cavity and then pain. Getting rid of the pain is easy. You fill the cavity, the pain's gone.
Right.
But you're left with degeneration and a whole bunch of restorative dentistry to do so that you regain health. Well, that's what we do. If you have poor posture, if you have an injury that creates some sort of disruption in the body, you may have pain. But if you sleep face down with your head turned to one side and your arms cocked to one side every day of your life, eventually you're going to have degeneration, eventually you're going to have spinal degeneration, and eventually you're going to have pain. We can get you out of pain quickly.
You know, you have young children and I have young grandchildren, but when they were infants, they were told at one point to sleep on the belly, at one point to sleep on their back. That has changed back and forth. But let's talk about adults. If you had your way, how would you have people sleep?
The best way to sleep is on your back, head and neck supported, 2 or 3 pillows underneath your knees. That way we take the curvature of the spine and bring it close to the mattress for support. If you can't sleep on your back, then I say sleep on your side. Pillow underneath your head supported so you're in neutral. Hug a pillow or two and a pillow or two between your knees so your spine is in neutral. Sleeping face down, you start to get all these crazy postures, and then sleeping is the only thing we do during the day for the longest period of time without moving. So if you do that for 7 hours, you're eventually going to have poor posture.
Gotcha. Okay. Is it difficult for people to change their sleeping habits?
It's only difficult if they don't want to change.
Okay.
I tell people all the time I want to set you up for success. So try sleeping my way tonight. If you normally sleep for 8 hours with poor posture and you sleep my way for 1 hour, you've now decreased your poor posture by 1 hour. You now have only had poor posture for 7 hours. That's an improvement. Go back to it the next day and the next day, and by the end of the month, you'll have a new sleeping habit.
It's a habit.
It is a habit.
That's incredible. You know, their patients go home and say, this is how Dr. Dean told me how to sleep.
I'm in everyone's bedroom.
That's what a wonderful thing. We'll be back in a few minutes with Health Talk. This is Dr. Kenneth Levine. Thank you.